So if you're dealing with a toothache right now, you probably know how bad it can get. And it's not just about the pain. It's not eating, not sleeping, and not thinking straight. And here's the thing, not all toothaches are the same. And if you treat the wrong type the wrong way, you could actually end up making it worse. And by the way, I'm a dentist, and today I'll help you figure out what kind of tooth pain you're dealing with and also effective ways you can manage it at home based on what actually works and not guesswork. So let's jump in. Now, before we can dive into what you can do about your toothache, there's something important to clear. Not all tooth pain is the same, and that's why a one-size-fits-all advice often fails. And there are four major types of dental pain, and understanding which one you're in can help make all the difference. So even narrowing it down a little can help guide you to the right solution. So take a moment now and try and listen carefully as I walk you through the types and try and match what you're feeling with what's being described. And type number one is sharp shooting pain when you bite down. So this usually points to a structural problem. It could be a loose filling, a cracked tooth, or even something stuck between your teeth. And every time you bite, your tooth flexes slightly, and that flexing irritates the tiny nerve fibers inside. And think of it like a cracked windshield. So at first, you might not notice it at first glance, but if you ignore it for a long enough time, every bit of pressure can end up making it worse. And that pain often starts small, but it can escalate if it's ignored. And type number two is a throbbing constant ache that gets worse when you lie down. And this is a classic sign of inflammation or infection inside the tooth, which we call pulpitis. And when you lie down, basically the blood flow to the head increases, and the pressure builds up inside the tooth, and the pain intensifies. And if you leave that untreated, it can turn into a full-blown abscess, which is something we take very seriously in dentistry. And type number three is sharp, sudden pain that's triggered by hot, cold, or sweet foods. And this is often linked with hypersensitivity, which is caused by worn enamel, receding gums, or even an early cavity entering or exposing the dentin underneath. And the nerve here becomes exposed to stimuli that it's not supposed to feel, like temperature changes and sugar. And it's quick, it's sharp, but it usually fades once the trigger is gone. And type number four is a dull, persistent ache with facial swelling. And that's when the infection goes from beyond the tooth into the surrounding tissues, and that's when the pain shifts. So it's less about the nerve irritation from the tooth and more about the inflammation and the infection to the surrounding structures, to the soft tissues, to the bone. And swelling here with pain is a red flag. And it's your body's way of telling you that the infection here isn't localized anymore. And in some cases, it can spread to other parts of your body, can go into the neck, to the jaw, and even into your bloodstream. Okay, so have you got a sense of which type fits your pain? And even if you're unsure, narrowing it down can help you make better decisions about what I'm going to show you next. And let's start with one of the simplest but most effective remedies, salt water. And I know it sounds basic, but when done correctly, warm salt water can actually not just be soothing, but also therapeutic. And what it does is it creates a hypertonic environment and it draws out fluid from swollen tissues. And it also breaks down bacterial cell walls and reduces infection load. And also, the warmth improves circulation and it helps bring in immune cells to the area to promote healing. And here's what works best. Use half a teaspoon of table salt, non-iodized ideally if you have it, in 8 ounces of warm water. And stir it until it's completely dissolved, because undissolved salt here can irritate your gums. And also make sure you use warm water and not hot, because hot water can burn the inflamed tissue. And then take a mouthful and gently swish it around the painful area for about 30 seconds. Make sure you're bathing the area and not scrubbing it aggressively. And then spit it out completely. Make sure you don't swallow salt water, especially if you have high blood pressure. And repeat this 2 to 3 times a day, ideally after meals or even before bed. And this usually works best for type 1 pain, which is mechanical irritation like cracks or food impaction, or even type 4 pain, swelling from an early infection. And here's when I would be cautious. So if you have type 3 hypersensitivity, salt water might sting or even worsen the pain. And even if you have a sodium restricted diet, make sure you check with your doctor first. And for better results, what you can also try is chamomile tea instead of plain water, because chamomile has mild anti-inflammatory properties and is gentle on the tissues and the gums. And it's a small upgrade, but it can make a noticeable difference. Now let's move on to cold therapy, specifically what I call the 20-20-20 rule. So cold therapy reduces the swelling by constricting the blood vessels and numbing the area. And the timing here also matters, because if you put too much cold for too long, it can actually cause tissue damage. And what I do is I'd apply a flexible cold pack or even a pack of frozen peas wrapped in thin towel, and then apply it to the outside of your cheek. Leave it there for 20 minutes, not longer, and then remove it for another 20 minutes. So let your tissues recover and repeat that as needed, up to 20 cycles a day if the pain and the swelling persists. Now, here's why this matters, because The first 15 to 20 minutes actually slows the blood flow and reduces the inflammation. But beyond that, the body tries to counteract the cold by increasing the blood flow, which is called reactive hyperemia. And that can worsen the swelling if you're not careful. And this pain is best for, or this remedy is best for type 2 pain, so deep throbbing inflammation, and type 4 pain, which is swelling or an infection spreading beyond the tooth. And here's when I'd be cautious. So if the pain is triggered by cold, as in common with type 3 sensitivity, cold therapy might make it worse. And if the swelling spreads rapidly towards the eye or towards the neck, stop and seek emergency care immediately. And for bonus tip, also keep 2 ice packs ready, one in use and one for refreezing, because it makes it easier to follow the 20-20-20 rule without any breaks. Now let's talk about medications and how to use them strategically. So what I've seen is a lot of people wait until the pain becomes unbearable before they decide to take something. And by then, you're just playing catch up. So there's a better way. Ibuprofen and paracetamol or acetaminophen in a staggered schedule. So ibuprofen targets the inflammation at source. It's a non-steroid anti-inflammatory drug. And paracetamol works slightly differently. So paracetamol works centrally. It changes how your brain processes pain signals. And both work differently, and alternating between them covers more pain pathways without having to exceed the safe limits. And so a typical schedule here would be 8 a.m. ibuprofen, 11 a.m. paracetamol, 2 p.m. ibuprofen, and 5 p.m. paracetamol. And for the safe dosage limits, don't exceed 1,200 milligrams of ibuprofen per day for dental pain, and don't exceed 3,000 milligrams of paracetamol, even though the absolute here is 4,000. Now, who should be cautious? So if you have stomach ulcers, kidney disease, asthma, or even if you're pregnant, talk to your doctor first. And this method usually works best for type 2 pain, so throbbing pulpal inflammation, and type 4 pain, swelling with systemic symptoms. And as a bonus tip, make sure you always take ibuprofen with food to minimize stomach irritation, and paracetamol here can be taken with or without food. Now let's move on to a more natural option, which is clove oil. And clove oil has been used for more than 2,000 years to manage dental pain, and the science here supports it because clove oil contains eugenol, which blocks sodium channels in nerves, and similar to how lidocaine works, which is used in dentistry to some extent. And what I do is I'd suggest you take 2 or 3 drops of pure clove oil into a teaspoon of a carrier oil. So that can be olive oil or coconut oil. And then soak a cotton ball or a swab into the mixture and place it on the most painful area for 2 to 5 minutes, and then rinse your mouth. And this method usually works best for type 1 pain, so irritation from cracks or food impaction, and type 3 pain, so nerve hypersensitivity, but make sure you use it with caution. And here's when I would be cautious. So if you have sensitive gums, a bleeding disorder, or you're taking blood thinners, avoid clove oil. And also, it's not recommended for children without professional guidance. And as a pro tip, what I'd suggest is use pure clove oil, not the commercial versions like the ones with alcohol or additives in them, because these can actually irritate the gums or the tissues. Now, before we finish, let's go over what not to do even if you're desperate. And these are mistakes I've seen people do that cause more harm than good over the years. And number one is never put aspirin directly on your gums. It doesn't help with the pain, and it can actually cause chemical burns. And what I'd do is I'd suggest you swallow aspirin as directed and never apply it topically. Number two is never try to drain a swelling yourself. So trying to pop or drain an infection at home can actually push the bacteria deeper, leading to life-threatening complications like Ludwig's angina or sepsis. And number three is never put ice directly onto your tooth, because the extreme cold here can kill the nerve of the tooth and can cause more trauma. So always use a cold ice pack onto the outside of your cheek and not directly onto your teeth. Number four is never rinse with high proof alcohol. So it damages tissue, it can worsen inflammation, and it can interact dangerously with medications. And tip number five, never just wait it out, because tooth infections don't resolve on their own, and delayed treatment almost always means bigger and riskier procedures later. So when should you stop managing it at home and get help? So you need to visit the emergency care right away if you have difficulty breathing or swallowing, if you have a swelling that's spreading towards your eye or down to your neck, or if you have a high fever with chills, or even if you're confused and you have a rapid heartbeat. And I'd also suggest seeing a dentist within 24 hours if you have pain that's constant and that's not being relieved by medication, or if there's visible pus or discharge, and if there's a tooth that has become loose after trauma. And the time which I'd suggest scheduling an appointment within a few days is if you have pain that's manageable but persistent, or temperature sensitivity that's getting worse, or if you've lost a filling or a crown. And just one thing to be aware of, if a toothache suddenly disappears without any treatment, It could mean that the nerve inside has died. And while that might feel like a relief, the infection can still spread silently. And make sure you always follow that up with a dentist or a dental professional. And thank you for watching. And if you found this helpful, feel free to share it to someone who might need it.